an AMI digital exclusive.
We are the Gillison family and we are one!
When Emery was diagnosed with Duchenne muscular dystrophy at the age of 3, one of the most important places for him and his family was Holland, Bloorview.
Duchenne muscular dystrophy is the most common muscular dystrophy in pediatrics. It affects boys, and there are approximately 1 in 5,000 boys that are affected with Duchenne muscular dystrophy. And right now in Canada, there are about 800 boys, youth, and young men that have Duchenne. It's a condition that affects muscles, and so it can affect your heart muscle, your big muscles of your body, so your muscles you use to walk around, and it can also affect your breathing muscles.
Dr. Laura McAdam is part of the clinical team at Holland Bloorview, who treats the young men and boys with Duchenne muscular dystrophy, including Emery.
Some of my research is focused on the human dimensions of illness. So that's the name of the broader research study. And it's really looking at it from a healthcare provider's perspective, but more importantly, a child and youth perspective and a family perspective. We really want to know what's important to them. How can we help them focus on those important human aspects, both inside and outside of the clinic setting?
Funding and research have gone into a clinical trial, which they hope will continue to slow down the progression of Duchenne.
So at Holland Bloorview, we're participating in a phase 3 clinical trial. Right now in Duchenne, we don't have a cure. We have a medication we can use to try and help slow the muscle weakness coming. And so what this study is looking at, if we put another medication together with his primary medication, a corticosteroid, can we slow it even more? Our hope is that we're going to slow the muscle weakness for a much longer period of time. So hopefully when we get the results of the study, it's actually going to show what we're hoping it's going to show. I think what's really important for families, and as well as for youth and children with Duchenne, is that we are participating in clinical trials. It gives some hope. It helps them know that we're invested as they're invested in looking at trying to make things better in the future for Emery, his family, as well as for all boys and young men with Duchenne.
Find out more about unique Canadian families. Visit AMI.ca/weareone.